As a mental health professional working in the field of mental health, there are many challenges. Mental health is an emotional language, and so when our clients or patients present, and especially important when you're in that state of crisis and you really need to speak to someone, we need to be able to offer in that moment, at that very moment, services in your language of choice. So I always go back to a very important time in my professional career where I was able to do interviews with over 100 seniors across Ontario and francophone seniors. And there was always one citation that stood out for me. Quand j'ai mal en français. When I hurt in French. And so when you translate that to what it is we do in the mental health and addiction sector, where you may be presenting in a heightened state of crisis, you think about the importance of your emotional language. And at the end of the day, when you're in that heightened state of crisis and you're needing to seek out help, you often revert back to your maternal language. So you want to be here as a francophone, speaking in French, receiving services in French, and getting help by someone who could actually understand you and what you're trying to say at that very moment in time. Active offer is so important, and that's our role at the end of the day as healthcare providers, to make sure that we are letting clients, patients, anybody who's coming in for our services, and know that we are here to serve them in French. And I think as healthcare providers, I think with good intent, we have organizational plans, policies, we try to recruit professionals in both languages, but that at the end of the day is the practice of. And the practice of, I have my name tag here right now, Je parle le français. It's not always something that first step that we, actually, did you even notice it, right? It's here hanging on my neck. But we need to go out of our way and put a lot of effort into making sure the first sentence that comes out of our mouth is bonjour, starting with the French. Puis-je vous aider? Do you prefer your services in French or in English? And go on from there. I was preparing for a mini research forum with CNFS last year, and so I said, I'm going to pull my data for francophones, and that wasn't very easy. So it was something very low, let's say 3%. I thought, that can't be right, because we know what the population of francophones is. So that right away I knew was definitely inaccurate. So I said, okay, let's stretch it a bit. Let's see who identified themselves as French at least once, and then we'll take that and work with the data a bit. And so, that brought my number up to 9%. Somebody might have identified themselves once, but they might not have identified themselves the third, fourth, or fifth time they came and used our services. And so that brings to light a lot more questions than answers, because you need to start asking yourself, why? So why are we not identifying ourselves? Is it because we're not asking questions? Are we not practicing active offer? A lot of the time I spent with seniors way back when talking about the importance of health services was there are some fears. There are fears that they might have to wait longer. There's fears around quality of services. There's so much more to it than that. But we actually don't understand that. And when it comes to mental health, it's even more important, because it is an emotional language that's required at the time when the individual presents. So it's back to state emergency, back to your maternal language. I need to speak in French. If we're not able to do that, then we are completely, we are missing for those who present.